Hello everyone, I'm Rahmah. So I'm going to start this video with the patient information. So our patient is Mr. ABC. He is 55 years old male. His ethnicity is others. He is married. His highest education level is primary school. Currently he is unemployed and lives at Bandar Ceras. He went to Hospital Sedang for his checkups and he has stopped smoking and now drink occasionally only. For the significant findings, the patient lives with his wife and he will go to the hospital with his son or wife. Otherwise, he will go by himself by using the bus. He also mentioned about his refrigerator which has been broken and he managed all of his medicines. We also find out that his blood pressure is very high, which is 140/91 mmHg, and the patient seems to misunderstand of the insulin regimen. He stored unused insulin cartridge at room temperature and disposed needles in a plastic bag, and we found a lot of insulin cartridge left over. For the medical history, the patient has been diagnosed with diabetes mellitus and non-STEMI for 4 years. He also recently developed diabetic wound, which is diabetic foot ulcer, and he also has a right palm hand abscess and also bilateral thigh abscess. His current medication are insulin R12 unit PDS, insulin N 18 unit ON, clopidogrel 75 mg 1 tab OD, acetylsalicylic acid 100 mg plus glycine 45 mg or cariprin 1 tab OD, cloxacillin 250 mg 1 tab OD, and there is also an unknown cough capsule which he said he got it from his friend and he took it for 1 tab OD.
We continue with drug-related problem and pharmaceutical care issue. First, the patient was having high blood pressure but no antihypertensive drug was being given to the patient. According to the guideline, the patient was having hypertension and should undergo screening and diagnosis. Secondly, the patient may not be taking insulin R at the right frequency, as the patient was unsure about the right frequency. Patient also did not have refrigerator to store the unused insulin, which may cause the insulin to be no or less effective to the patient. According to a reviews, the storage condition may affect the stability and potency of the insulin and eventually unable to decrease the blood sugar level significantly. Next, improper disposal of needle by the patient, as the needle was disposed in a plastic bag. According to FDA, they should be disposed in the shop's disposal container and the container should be changed when it is 3/4 full to prevent overfilling. Moreover, there was wastage of insulin as there was a lots of insulin cartridge left over, which may due to lack of knowledge of when to change the cartridge by the patient, and it was suggested that the cartridge should be changed when the piston is below the white line on the scale. Patient also experienced pain during insulin injection, which may due to the bending of the needle, as the same needle was being used for 3 days. It was suggested that a new needle should be used for every injection or at least changed them once a day. Furthermore, patient injected insulin at the same site, which may cause lipodystrophy and eventually erected absorption of insulin. According to a study, the site of injection should be rotated to prevent lipodystrophy that may cause poor glycemic control and unpredictable hypoglycemia. Patient also having poor vision. Therefore, he was unable to differentiate two different types of insulin. Next, there's potential of wrong dosage of cloxacillin prescribed for infection, as according to CPG guideline, the dose should be 500 mg 6 hourly. Patient also experienced dry cough and SOB after doing heavy works, which may indicate worsening of his non-STEMI, as they are the symptoms of heart failure. Moreover, use of both clopidogrel and cariprin increased the risk of bleeding and worsened the condition of diabetic foot ulcer and abscess wound on his limbs. According to a study, the drug therapy was associated with an increased risk of bleeding. Lastly, the patient experienced abdominal pain after taking clopidogrel and cariprin, which is the reported adverse drug reaction of the drugs.
Now that we know about the patient problems and issues, let's discuss about the intervention plans. The first aspect that we can tackle is the patient's medication management. We can suggest the patient to use a pill box to ease him to remember to take his pills, as the patient is now on 3 oral medications. Next, because the patient has two different types of insulins, we can suggest him to place the different types of insulins in different plastic containers with large labels. We can also make a medication identification chart to allow the patient and caregiver to identify each medicine. Finally, because the patient's refrigerator is currently broken, we can request help from his neighbor or children to keep his unused insulin in their refrigerator temporarily. On the aspect of medication knowledge, we should educate the patient on the name of each medication and its functions. Next, we should re-educate the patient on the proper use of insulin, including its uses, methods, storage, and disposal methods. We should also help to identify the reason behind the patient's low perception score. And finally, because the patient is unsure of the correct frequency of insurgent R, we should help him to understand the correct frequency of that drug. In regards of the medication-related issues, the patient complained of abdominal pain while receiving clopidogrel, so we should monitor the abdominal pain to determine if the pain was caused by the drug. The patient is potentially prescribed with the wrong dose of cloxacillin, so we should call the patient's physician to reconfirm the correct dose for cloxacillin. In terms of the patient's clinical condition, the patient was found to have a high blood pressure in the recent blood check, so we should issue a referral letter for the patient to follow up with his physician. The patient also complained of dry cough while carrying heavy stuff, so we should advise him to avoid carrying heavy stuff or request assistance from others if necessary. The fifth aspect that we can focus on is the patient's over-the-counter medication. We should confirm the source and identity of cough capsule mentioned by the patient. And finally, on the aspect of financial, we can assist the patient to reach to the respective welfare department and non-governmental organization regarding his financial problem.
Okay, hi, I'm Wei Jie. So we are going to present our brochure regarding diabetes mellitus. So the objective of the intervention is firstly to empower patient knowledge and understanding towards their disease and medication, because we found that the patient had scored 2 out of 4 in both knowledge and perception towards his disease. Consequently, we can increase the medication of adherence of this patient, therefore prevent worsening of diabetes mellitus. Besides, through the brochure, we can ensure proper and correct use of medication, as to allow patient to use medication, for example, insulin at its best performance. So this is our brochure, which is designed by our group mate Azizah, and this covers the storage of insulin, change of insulin cartridge and needle, basic information about diabetes mellitus, technique of insulin injection, and also site of insulin injection. Consideration we have thought of, we use Bahasa Malaysia as the media, as it is more easier to comprehend since patient has minimal educational background. Next, we use layman term. For example, we choose paras gula dalam darah instead of paras glucosa darah. Next, we also use larger and bold wording as to assist patient in reading. Illustration is provided to aid in understanding, specifically instead of insulin injection, and provide a good platform for memorization. This brochure is simple, plain, and yet attracting but not too crowded. Therefore, it is pleasant to be read by the patient and caregiver.
Now let us look at the monitoring plan for the post-visit. First, we will monitor the sign of bleeding such as the gum bleeding, red blood in stool, nosebleed, unusual bleeding, as well as the wound condition due to the potential bleeding complication caused by the clopidogrel. Next, we will monitor the diabetic wound condition by looking at the sign of infection such as a redness, discharge, or any foul smell. Next, how we know patient's blood pressure and blood glucose level are still controlled. We can monitor the result from the blood glucose test and the record from the blood pressure measurement done. Next, we will assess the patient's knowledge, perception, and adherence on the next visit. On the next visit, we also will assess the storing issue of the insulin and the medication. Lastly, we will assess the needle disposing, cartridge changing, and the insulin pen using technique of the patient on the next visit.